Good afternoon, my dear friends. Thank you very much for tuning in to the Ken Rampersaud Show here on Island Zone Radio and Facebook Live. Some people are thankful and they focus less on the pillow we lack and more on the privileges we have. Yes, it's good that we be grateful for the things that we have in this world. You know, a lot of things going on in the world. A lot of us losing some sleep for our beloved Guyana. And you know, today the world is celebrating International Women's Day. And so I want to take this opportunity to big up all the women in the world who think that women was not important in their life. Guess what, ladies and gentlemen? Look at the screen. We have a woman from our own beloved Guyana. Roxanne George, our country, now is in her hands. You know, today as I was watching the way she was presenting her case, I have to tell you, I was listening very keenly and I was paying a lot of attention of all the things that she was saying. I can tell you that I admire the way and I like the way that she was presenting her case. She reminded me when I am judging the birds. And I'm going to give you a little insight of how I do it as a judge for birds. You know, when I'm judging and I have a lot of people in my audience, I really talk a lot about the birds, especially the birds that I want to win, because I don't want anyone to say I am taking sides when I'm judging. So as I was watching her, I was thinking about me and thinking about her. The world is watching her and Guyana. Ladies and gentlemen, thank you very much for watching the Ken Rampersaud Show here on Island Zone Radio. As I said, I went last night and I was videoing the live proceedings in Richmond Hill, Little Guyana. And I was very impressed that there were so many people there, and everyone that was there, guess what they wanted? Democracy. And like all of us who have a good conscience, that's all we're asking for anything and anywhere we go, that people must treat us right and fairly. I'm going to have our DJ play another song, and when we come back, we will talk a little bit about pneumonia. You know, a lot of times, a lot of us hear about pneumonia and we don't know what pneumonia really is. So I will try to break it down as simple as possible for some of you guys. Also, at around 5 o'clock, we have Mr. Baldeo, Albert Baldeo. You know, he's a community leader here in Queens. I'll be talking to him, and he will give us a little insight of what's next going on in Guyana and what is the option for the people who is seeking justice. So let's go, DJ, with another song. Ladies and gentlemen, you are...
Put hands up in the air. representing for Chicha
One people, one nation, one destiny.
Welcome back again to the Ken Rampersaud Show, guys. I'm so excited to see so much you guys tune in to the show. Guess what? I see Juanita Can. You tune in. Ryan Jeffrey, as known as DJ Fest. Thank you very much. And my very good friends, the pair, the wonderful pair, I would say the pair of the year, Michael Nalini Naidu, always looking good. Anywhere I go, I see them always sparking, representing the best of what love is really all about. Ryan Persad, thank you very much. And you know what? Yesterday, I had the privilege of Arvin Apadu. He visited me, and I tell you, he's such a warm and caring, good guy. Good to have as a friend. Rajan Narayan, thank you very, very much, my brother, for tuning in. Shelly Backus, thank you very much. Sonia, watching all the way from Guyana. We have in the studio today Miss Varshini Kedarnath, very busy with her maths homework. Shelly Backus, good afternoon. And when I see your comment, I smile. When you said good afternoon. Nandira Santi Ramesh, you know, Nandira Santi, we went to school back in Guyana, and it's good to have her in my life here. We were good friends back in Guyana. Rita Jagmohan, good afternoon. She's saying to everyone, Nayan Chunilal, watching all the way from Guyana. Teresa Singh, it's always a pleasure having you watching the Ken Rampersaud Show. And Michael Nalidi said, good afternoon, Ken, and good afternoon to you guys. Nirmati Dat, thank you very much for tuning in. My good friend all the way from Suriname. John Namat, thank you very much for watching this show. Teresa Singh is spreading a lot of love, and she is praying for love. John is saying good afternoon to everyone. Aditya is watching too. Very good. My cousin all the way from Guyana, Anne-Marie Gafour. Good to have you on. And, you know, Roxanne Walker Hamilton, a good friend of myself and the family all the way from Florida. And what I like about Roxanne, she is so peaceful and so good. She is a neutral woman. Glad to have you on. Roshani Baksh, my good friend all the way from Guyana, and she's living in the States. Roshani, thank you very much. I hope that you accept my friend request. It's good to have you on. Red Sonia, good afternoon to you. Juanita said, oh yeah, good. Thank you very much. Narima is saying, hello, John Nemet. Happy Sunday. And Russell, thank you very much for all that you're doing. I'm so glad that you're helping to share the page every week. And guys, please share the page. That, you know what, we could encourage each other to do what's best for us. And in terms of medical diagnosis and so on, I'm trying to breaking it down for you guys. Sukdev Mangal, thank you very much for always keeping my company during the week. Roshini said, good afternoon to Ken and family. She is related to Geeta, so it's good to have you on. I see you're watching everybody else's show but mine, so then I said, you know, let me encourage you to watch the show. So good to have you on. John is saying she should sing, I am an honest Guyanese. I don't like injustice and fraud. Shelly Backus, I'm a Guyanese to the bone. You know what? I am a Guyanese to the bone too. I have left Guyana for such a long time. But if you cut my heart, guess what? If you cut me open, you will see the flag of Guyana waving very high. And I'm always proud to say I'm a Guyanese, no matter where I go. And I know that you guys share the same sentiment as I do. And good to have you guys. Chan Bridgmohan, thank you very much, Chandy. It's good to have you, my friend from Guyana. She lives in the States. She lost her husband many years ago in a big accident. All right. Rajiv Nandalal is in studio. Good to have you. My aunt Delari Sigobin is watching all the way from Guyana, and I tell you, she is one of the women. I want to big up all the women who's watching this show today, and you know, to my mother who's dead. Happy International Woman, and I have to give credit to my aunt Delari Sigobin for bringing me here in the United States to give me a better life. So kudos to her, to all you beautiful women. Nalo, Kishore Gopal, thank you very much for watching the Ken Rampersaud Show. Bibi Hanif, watching all the way from Florida. Roxanne, yes, you said. Hi, my dear. Shireen Basant, good afternoon. Hi, DJ. Have a wonderful and blessed day. Yes. Let me see. Yes, Delari is good evening, Mr. You don't have to call me Mr. Doridanti. Kenneth is good enough, and that's for everyone. I am just a simple guy. Kenneth or Ken is just good enough for me. And then P. Parveen, thank you very much for watching. Let me see, watching from Hollywood, Florida, praying for our beloved country, Guyana. We all are doing it. And you know, when I wake up in the morning, one of the very first thing I'm thinking about is Guyana. So keep praying. You never know what could happen. But whatever happened, you know what I'm saying? I would ask you guys and, you know, share the message. We don't have to be negative. We don't have to call people dogs and different names. You know, we all have feelings. No matter what people do, sometimes you have to overlook. So as we are going through this difficult time and process, I would encourage you guys to just be kind and gentle with your words. Let's see. Devendra Singh, I'm planning to come back to my country to live next year, but I can't. You can. Actually, I'm planning to go to Ghana to do some work on domestic violence in May. I hope I can still go and do that. So let's go, guys. Sylvain Bisram, thank you very much for watching. Please continue to share the page. I'm going to ask the DJ to play another song for me, and then I'll come right straight to the point. Pneumonia. Let's go.
Tiring times, giving up is foolish. Let me clear your mind. So if you're feeling down, please think about this. Think about this. You have one life to live, and it's your gift. It's your gift. When all darkness is gone, you'll be happy again. Happy again. So if you're feeling down, please think about this. Life is your gift. I know you've been through pain in so many forms, but no one was there and you cried all alone. But these tears are only your weakness that you'll use one day to make you strong. Life is short, but it's worth it. Remember to live it to the fullest. I know you're facing tiring times. Giving up is foolish. Let me clear your mind. So if you're feeling down, please think about this. Think about this. You have one life to live, and it's your gift. It's your gift. When all darkness is gone, you'll be happy again. Happy again. So if you're feeling down, please think about this. Life is your gift. So if you're feeling down, please think about this. Life is your gift. My darling, you'll grow up someday. My darling, you are special. My darling, you are loved. My darling, your life's worth it. So if you're feeling down, please think about this. Think about this. You have one life to live, and it's your gift. It's your gift. When all darkness.
Good afternoon again, ladies and gentlemen, and welcome to the Ken Rampersaud Show. I want to tell you next week's program is going to be about the coronavirus. I'll have Dr. Veronica Wiltshire. She's going to be here, and we'll talk about it, how to prevent this virus. Also, I want to say special hello to Kandaya, who's watching all the way from Florida. Bibi, thank you very much for watching. So let's talk about pneumonia. A lot of times we hear about pneumonia, walking pneumonia, different pneumonia. And you know what? A lot of people don't know what it is. So pneumonia is an infection that inflames the air sac in one or both lungs. So, you know, we have two lungs in our chest, right? And they are divided into different lobes. The air sac may fill with fluid or pus. And most of you guys know what pus is, causing us to cough with phlegm or pus. We get fever, chills, and difficulty breathing. A variety of organisms, including bacteria, viruses, and fungi, can cause pneumonia. Pneumonia can range in seriousness from mild to life-threatening, and in most cases, it can be serious for infant and young adults. People also older than 65 years old and people with health problems or weak immune system, and we will talk about immune system a little more later. Also, some of the symptoms that we'll be looking for, it varies from mild to severe, depending on the factors such as the type of germs causing the infection and your age and your overall health. Mild symptoms and signs often are similar to those of the common cold, but they last longer. And we talk about symptoms, what we're looking for: chest pain when you breathe. Sometimes you're breathing, and when you breathe in, you're getting some chest pain, or severe cough, confusion, or changes in mental awareness. And in adults, 65 years and older, cough which may be which produce phlegm. You will also get fatigue, fever, sweating, and shaking, chills, lower than your body temperature in adults 65 years or older, and people with weak immune system. Now you will get nausea, vomiting, and some diarrhea, also shortness of breath. Newborns and infant may not show sign of the infection, or they may vomit, have a fever, cough, persistent restlessness, or tiredness, without energy, or have difficulty breathing and eating. And that's why it's important. As you know, children sometimes it's hard to tell what's going on with them, especially babies. So one of the best things that you can do as parents, you see what's going on with your child and you take them to the hospital. Don't take things into your own hands, because guess what? You can end up losing your child. And especially when you have older adults living in your house, 65 years or older, the best thing to do is to take them to let them go see a doctor, okay? And we're going to talk about, when do you really go and see a doctor? See your doctor if you have difficulty breathing, chest pain, you have a persistent fever which is 100 over 102 degrees or higher, or a persistent cough, especially if you're coughing up pus. So when you see you're coughing and that's coming out from deep within, and you see it's kind of pussy, that's when you really have to go to the doctor, because guess what? That's when you really do have an infection in your lungs. It's especially important that people in these high-risk group, you go see a doctor. Like I said, if you're older than 65 years old, children, younger than 2 with signs and symptoms. We have people with an underlying health condition or weakness immune system, people receiving chemotherapy or taking medication that suppresses the immune system. And why we say people who low immune system: when you have a low immune system, you're susceptible for not only pneumonia but so many other diseases. And the other thing is that when you're getting chemotherapy, you know that chemotherapy destroys both your white and your red blood cells. So it's important that if you are going through having chemotherapy, you need to go and check with the doctor and see what's going on. For some older adults and people with heart failure or chronic lung problem, pneumonia can quickly become a life-threatening condition. Yes, you can die. And I'm going to ask my DJ to get ready to get a song. And we want to talk about what causes it. Many germs can cause pneumonia. The most common are bacteria and viruses in the air that we breathe. Your body usually prevents these germs from infecting your lungs, and that's why you have a good immune system, right? But sometimes the germs can overpower your immune system, even if your health is in general good condition. Pneumonia is classified according to a couple different phase. And so when I come back from the music, we're going to talk about the different kinds of pneumonia that we have. Okay? Thank you very much, guys. Let's go for some music.
You know you're on the road, one step closer you go. know you're on the road, one step closer you go. You know that you're a champion, let them watch you as you glow. No one can stop your vibes, all your powers are ignite. Let all the voices fade, now nothing will come in your way. 'Cause you are a ray of sunshine, everybody wants your sunlight. And you are a magic light bulb, everybody wants your brightness. Dark days will come and go, but you're still burning in the cold. You are your force to reckon with, when you eat you feed your soul. No one can stop your shine, one more breath towards your goals. Breathe, 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 you're a champion, let them see what's in your blood. 'Cause you are a ray of sunshine, everybody wants your sunlight. And you are a magic light bulb, everybody wants your brightness. You are the strong, courageous one. You are the light within your soul. You are the greatest strength I know. Oh, you are the reason for your smiles. You are the sweetest thing alive. And I'm so happy now you know. Now you know, you know. 'Cause you are a ray of sunshine, everybody wants your sunlight. And you are a magic light bulb, everybody wants your brightness. 'Cause you are a ray of sunshine, everybody wants your sunlight. And you are a magic light bulb, everybody wants your brightness. 'Cause you are a ray of sunshine, everybody wants your sunlight. And you are a magic light bulb, everybody wants your brightness.
Well, good afternoon and welcome back to the Ken Rampersaud Show. Let's see, there was a Gloria name that I saw just now, but it just disappeared. So, guys, if you don't see, I call your name, just say something so I can call you, can say something to you. She said, so Dave said, thanks, I'm writing it all down. Well, thank you very much, Shireen Basan. Thank you very much for tuning in. Arvind Basan, thank you very much for watching the Ken Rampersaud Show. Sukdev Mangal, this is a respiratory problem, so I doubt whether you will get that earache. You may get short of breath, you can get coughing and so on. Let's see. Anand P, thank you very much for watching. The best thing to kill coronavirus is 12 carbs a day. Big up to my Trinidad friend and for Guyanese in 24 banks beer. Oh, Lord Jesus, you're going to put me in trouble, boy. Nagita, thank you very much for watching the show all the way from Guyana. To my cousin Bagmati Rambarak, thank you very much for tuning in. Mary Khan, thank you very much. I see Geeta Rampersad is watching. Thank you very much, my dear Geeta, for watching your husband here. So let's go. We're talking about the different form of pneumonia. So we have community-acquired pneumonia. Community-acquired pneumonia is the most common type of pneumonia. It occurs outside of the hospital or healthcare facilities. It may be caused by bacteria, right? We have bacteria. The most common cause in the United States is Streptococcus. This type of pneumonia can occur on its own or even after you had a cold, the flu. It may affect the part of your lobe in your lungs. As I said, you have different parts of your lungs, different lobes, and condition that's called lobar pneumonia. So sometimes it doesn't have to be the whole lungs. It could be like part of your lungs. We have bacteria-like organisms, mycoplasma pneumonia. also can cause pneumonia. It typically produces mild symptoms than do the other types of pneumonia. Like walk-in pneumonia is an informal name. A lot of times you hear that people saying, I have walk-in pneumonia. So pay attention to this one. I'm saying I'm going to go back again. I say it's bacterial-like organism, mycoplasma. Pneumonia also can cause pneumonia. It typically produces milder symptoms and do like other types of pneumonia. Walk-in pneumonia is an informal name given to this type of pneumonia, which typically isn't very severe, and you may require some rest. But like I said, always go and check your doctor, because don't try to diagnose yourself. If you diagnose yourself, you can be wrong, and guess what? You will end up in a lot of problem. We have the fungi. This type of pneumonia is the most common in people with chronic health problems. So I'm going to tell you again, this fungi, this type of pneumonia is very common with people who have cancer and so on. With a weakened immune system, and in the people who have inhaled large doses of the organism, the fungi that causes it can be found in soil and birds dropping, and vary depending upon the geographic location. And when we talk about fungus, some of the viruses that causes cold and the flu can cause pneumonia. Viruses are the most common cause of pneumonia in children younger than 5 years. Viral pneumonia is usually mild, but in some cases it can become very, very serious. So I'm always advocating to you guys to make sure you go to the doctor and get help. You have hospital-acquired pneumonia, and when I was in the hospital, there's a lot of times I will see people come in with one thing and they will end up getting pneumonia. Some people catches pneumonia during a hospital stay. For other illnesses, hospital-acquired pneumonia can be very serious because, the bacteria causing it may be more resistant to antibiotic, and because the people who get it are already sick. And you can get who have cancer and so on. Older people who are on like ventilator, who are on the breathing machine, often used in intensive care unit, are at a higher risk of this type of pneumonia. We have healthcare acquired pneumonia. Healthcare acquired pneumonia. Pneumonia is a bacterial infection that occurs in people who live in long care facility. Let's say for the like nursing home or so on, or who receive care in the outpatient clinic, including like places like dialysis centers, like hospital acquired pneumonia. Healthcare acquired pneumonia can be caused by bacteria that are more resistant to bacteria, to antibiotics. So one has to be very, very careful when you go to these places like the dialysis center or the long-term care facility. Make sure you wash your hand often and make sure you follow all the cleaning protocol, okay? Aspiration pneumonia. A lot of times I notice that when we have patients, I'm going to ask my DJ to get a song ready, because this is one of the final aspiration pneumonia we have. And aspiration pneumonia occurs when you inhale food, drink, vomiting, or saliva in your lungs. Aspiration is more likely if something disturbs your normal gag reflex, such as the brain injury or swallowing problem or excessive use of alcohol or drugs. What I can tell you, that if you have someone who had a stroke or suffering from a stroke, for example, they can get this aspiration pneumonia, because the muscle in their neck and the throat it becomes weak, so they can't swallow that quickly, and guess what? Some of the food can escape, go down the windpipe and get into your lungs, and that's why when you're feeding elderly people, you always raise that bed up, and if you go to the hospital, you will see sometimes your family member, the bed is elevated, the head is elevated, and one of the things that we do while we're feeding someone is to prevent them from getting aspiration pneumonia. And you know what? A lot of times that person can end up dying because if the food go into the windpipe, it could block the passage, and guess what? You could end up dying. I saw a patient who actually had this kind of problem, and I know that someone who had aspiration pneumonia, and before the family member could have really get to help them, they started to turn blue and they died. So be very careful. Advice to when you're feeding, and children too. When you're feeding anyone, raise the bed up of the head side up so that the food can go in the right passage, and take your time and feed them. You don't have to give them a lot of food, little by little. Okay, let's go, ladies and gentlemen, for a song now from our DJ.
The Guyana flag, we gon' put it real high. Put up on the flag and I wave it in the sky. Guyana forever and it will never die. Guyana, 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 Guyana. Let me see you, make me hear you. Let me see you, make me hear you. One thing the warrior in can't understand. Why them a come and try to destroy we land? All of them a come and all of them a try. Say we must get a flyer. The Guyana flag, we gon' put it real high. Put up on the flag and I wave it in the sky. Guyana forever and it will never die. Yes, we Guyana's people. I wonder what them thinking. Where you wanna what them thinking? They can't hold me back.
Good evening, ladies and gentlemen, and welcome back to the Ken Rampersaud Show. I see a lot of Guyana flag there. Maria Harris, it's always good to have you guys on the Ken Rampersaud Show. Maria, thank you so much. And I see a very special lady just tune into the program, Miss Elizabeth Allen. I am so proud of all that you're doing for Guyana, for all the ladies. Today is International Women's Day, and I want to salute you that you are standing up for what's right in Guyana. It's good to have you on in the program. And for those of you who don't know Elizabeth, she's all the way from Hague on the west coast of Demerara, just a couple of villages away from me. So thank you very much, Elizabeth, and keep that fire burning. Ganika Singh watching all the way from Canada. Thank you very much for tuning in. I see Michael Nalidi is praying for Guyana. Good evening, everyone. Maria is saying yes. And Maria Harris, she went last night to the gathering there to make sure Guyana, we celebrate and we stand up for justice and for everyone. Know that Guyana, we here are standing up for you guys, for liberty and for everything that's right. Narendra Rampersaud, thank you very much for tuning in. Maria said, good evening, Ken. Gosh, I have to change the time. Yes, you have to change the time. Time now here, it's changed from this morning. I barely get to sleep a little bit last night after I went to the gathering last night. So I can't wait for tonight to come to get my extra sleep. So let's see. Anyone else? We have DJ Spider song. Just tune in. Thank you very much, DJ Spider. So again, Elizabeth, thank you very much for tuning in and for watching the Ken Rampersaud Show. And please, I know you guys are getting tired, but keep fighting and keep holding on for what's right. And so we were talking about the risk factors for pneumonia, and pneumonia can affect anyone. But the age group at a higher risk are children between 2 years old or even younger, people who are at 65 years or older. Other risk factors include being hospitalized. You are at a greater risk of pneumonia if you are in the hospital intensive care unit, especially if you're on the machine that's help you to breathe. Again, when you're having that ventilator, you're on a ventilation machine, you can and susceptible to getting this pneumonia. Chronic disease, you are more likely to get pneumonia if you have asthma, chronic obstructive pulmonary disease, which is COPD, or heart disease. Smoking damages your body natural defenses against the bacteria and viruses that cause pneumonia. So I always encourage my viewers and to all those who I cross path with to try and stop smoking. Smoking is not good for you. And I know that there is so much help here, especially in the United States and Canada. If you want to stop smoking, you have the patch, you have pills, you have so many other things you can talk to your doctor about to stop. And it's always good to get it supervised by your doctor. Weaken or suppress immune system. People who have AIDS or HIV, who have an organ transplant, or who receive chemotherapy for a long period of time, as I said earlier, that if you are getting chemo, you have to be very, very careful. Also, years ago, I know people who are HIV, AIDS, they're susceptible to a lot of diseases, so one has to be very careful too. Also, if you're having any kind of kidney transplant, be very careful when you're in the hospital. That's why when you're in the hospital and you have a kidney transplant, your doctor is going to try to tell you, not a lot of people could come and see you in the hospital because they don't want you to introduce any new bacteria to you, okay? So you can get offended when you're in the hospital with something like this and your family said, you can't come see me. One has to really understand. And even we talk about with complications, even with treatment, some people with pneumonia, especially those in high-risk group, may experience complications, including bacteria in the bloodstream. Bacteria that enters the bloodstream from your lungs can spread to infection to other organs, potentially causing organ failures. Difficulty breathing if you have pneumonia is severe or you have chronic underlying lungs disease, you may have a problem breathing in enough oxygen. You may need to be hospitalized and use a breathing machine like a ventilator while your lungs is resting and it's healing. Fluid accumulation around the lungs, which is like pleural effusion. Pneumonia may cause fluid to build up in the thin spaces between the layers of tissue that lines the lungs and the chest cavity, which is the pleura. If the fluid becomes infected, you may need to have it drain enough, and they will have to insert a tube inside of your lungs. And I don't know if you have ever seen it. They take a 2 tube or 1 tube and put it straight into. It's a big tube, help to drain your lungs. And so what you do, sometimes you go see someone, they have that little square box, very thin stuff next to the bedside, and you hear it's bubbling sometimes. And sometimes you see it's clear, sometimes you see pus, or sometimes you can see a lot of blood coming out of there. But that's what goes on when you see that. But you can't be scared. As a nurse, I always used to worry, and I said, what, I don't want this to happen to me, really. Lungs abscess, and abscess occur if pus form in a cavity in the lung. An abscess is usually treated with antibiotics, sometimes surgery, or drain with a long needle that they would place into your lungs. So one has to be very careful. And like me, I don't really like to get needles. So scared of those things, but you cannot be scared. You have to get things taken care of. And why they put a needle in there is to drain the pus out. So we're going to ask our DJ to pump this volume up with a little bit music. And when I come back, I'm going to talk to you a little bit how we can prevent pneumonia. Okay, let's see. We have Pam Citroen watching all the way from Guyana. There's another Roxanne on from Trinidad and Tobago. So I want to say, Roxanne from Trinidad, thank you very much for watching the Ken Rampersaud Show here on Island Zone Radio. I see Lalita Deo Prasad. Good afternoon, my dear. Thanks for watching. Let's go for some music now. Thank you for tuning in, Girly Prasad. Good afternoon. Good afternoon, Sham Deuchen. Thank you for watching. Jamir Mohammed, thank you for watching from Canada. Priya Prasad, all the way from Guyana. Thank you for watching the Ken Rampersaud Show. That's right, guys. It's best we be lovers, and rather than we fight, the world would be a better place if we really love each other and we exercise some love and patience. As I was saying earlier today, that's, you know what, we should refrain or stop calling people names on Facebook and, you know, saying all manner of derogatory names to people, especially at this very difficult times. I know it's hard in Guyana, but you know what, we still have to exercise patience and let the process go. So the Mangal respiratory problem, thanks for your assistance on this topic. Yes, you know, if you can't breathe, guess what? When you take your last breath, that's it. Life is done. So you have to take care of your lungs. That's an important man in your body. Good to have my Priya locked on. Priya, thank you very much. I see Ryan said, Kenneth, I hope you are not on Wi-Fi. You know what? I have to watch. I don't know what the guys did. But I'll check on what they're doing. The video kind of sticking. Let's see. Maria Harris, thank you very much for tuning in. It's so good to have you on. Amir Bacchus, peace and love. Yes, we are glad to have you guys sending positive messages, especially to our friends in Guyana and to our family. Bibi, it's going fast. Bibi Farzia, thank you very much for watching. I didn't get your whole name. It's moving. It's good to have Jamir Mohammed, who said, Blessed Sunday, Mr. Kenneth Rampersaud, and all to our listeners. Much love. Yes, Bibi Farina Bola, thank you very much for watching, and she's saying good afternoon. Billy Rameshwar, thank you very much from all the way from Lenora. Thank you very much for watching. We from the same village. And Lolita was saying, my mother-in-law, sister-in-law passed away from pneumonia in Guyana 2 days ago. I am so sorry to hear. You know, and that's why I am bringing these topics to hear for you guys that you can learn to. And when I read these things and I'm bringing it to you, I'm doing it as a simple form so all of you could really understand what I'm saying and in layman's term, okay? Avita Danraj, thank you very much for tuning in. Amir Bacchus, he's watching all the way from Ghana. Thank you very much. And so let's talk about prevention. You know, especially for the older population and young children. Get vaccinated. Vaccines are available to prevent some types of pneumonia and the flu. Talk with your doctor about getting these shots. The vaccination guidelines have changed over time, so make sure you review your vaccination status with your doctor, even if you recall previously receiving a pneumonia shot. And one of the things now I notice here in the United States, they're giving out pneumonia shots, and I encourage our patients and to all of you, especially if you're susceptible of getting this, if you have cancer, if you have HIV/AIDS, go and get your pneumonia shot, because you never know after you get this flu what else could happen. Make sure your children get vaccinated. Doctor recommend a different pneumonia vaccine for children younger than 2 years old, and for children 2 years to 5 years who are at a particular risk of pneumococcal disease. Children who attend a group children care center, like daycare center, should also get vaccinated, because different children, something could happen there, and not everybody takes care of their children as they're supposed to, and then when all these children meet up together, you don't know what they are susceptible of getting. Doctor also recommend flu shots for children older than 6 months old. Practice good hygiene to protect yourself against respiratory infection that sometimes lead to pneumonia. Wash your hands regularly, or use an alcohol-based hand sanitizer. And one of the things that I learned to do now is that I always keep in my car, especially when I'm pumping gas at the gas station, when I go in my car, I have some hand sanitizer that I'm always using to keep my hands clean. If you're in public places and you have to pull a door and go through a door all the time, where you see hundreds of people going, always wash your hands. And if you don't have access to water at the same time, use some gel, some alcohol gel, which is more than 60%. And we will talk about that more next week. Keep your immune system strong, get enough sleep, exercise regularly, and eat a healthy, balanced diet. And you want to know how your doctor would really know if you have pneumonia. Your doctor will start by asking you some basic medical questions and doing a physical exam, including listening to your lungs. And when they listen to your lungs with a stethoscope to check your normal bubbling, and for abnormal bubbling or cracking sound that sound like pneumonia, that suggests pneumonia. If pneumonia is suspected, your doctor may recommend the following tests. Blood tests. Blood tests are used to confirm an infection and to try to identify the type of organism causing the infection. However, precise identification isn't always possible. Then another thing they do regularly is to do a chest x-ray. This helps your doctor diagnose pneumonia and determines the extent and location of the infection. And that's why I tell you, you have your lungs and there's different lobes. So sometimes it could happen in one lobe and the other one is good. I'm so sorry that I don't have a picture of the lobe that you can see on the screen. I apologize, but it was on my mind to show you guys today. However, a chest x-ray can tell you exactly which lobe it's on. And then there is another pulse oximetry, which this measure the level of blood in your oxygen. Pneumonia can prevent your lung from moving enough oxygen into your bloodstream. And another thing that they can do is sputum tests. A sputum test, this is a sample from your lungs, sputum, and I'm not talking about saliva, which is in your mouth. The sputum is where you cough, and it's coming deep from within. That's what you want to do. So if your doctor asks you while you're in the hospital, listen, I need some sputum, it's not the spit that comes out of your mouth, really. You want something to come deep from within your lungs so that they could get a good sample and do a real good test of what's going on. And analyze to help pinpoint the cause of the infection. And when they find the cause of the infection, guess what? They can really give you a good treatment. Your doctor might order additional tests to see if you're older than 65 years old and in the hospital, or have serious symptoms and health condition. These which you have to do, right? And it's good to comply with all of these tests. Also, another thing you can do is the CT scan. If your pneumonia isn't clearing up quickly as expected, your doctor may recommend a chest CT scan to obtain more detailed information from the lungs. And a CT scan is better than a chest x-ray because that is more detailed, okay? And then pleural effusion culture. A fluid sample is taken by putting a needle between your rib cage and from the pleural area and analyzed to determine the type of infection. And what they do, they aspirate some fluid from there and then they send it to the lab and then they know what antibiotic to use. So I'm going to ask my DJ to get a song ready. And when he come back, in the meantime, I'm waiting for Mr. Albert Baldeo to come in. And when we come back, we'll talk more about the treatment of pneumonia. So let's go, ladies and gentlemen, with a nice song.
To the way of man, it's all nation the mind. Call me Musafir hu yaro, nagad hai naat kala, mujhe chalte jana hai, hum bas chalte jana. Musafir hu yaro, nagad
That's the man, Umesh Singh from the Wave Band, all the way in Canada. You know, I always like Umesh's song. Anywhere I'm going, I always make sure I have his song because I like the rhythm of the song, and it sets me in a different mood, ladies and gentlemen. Let's see. Let's play another song. I see Roshani back. She's still on. Good tune by, I know, I told him to to bring the music pump it up a little more because I know you guys love the music. Lalita Deo Prasad, she said, thank you, sweetie. Our Vindicator Not, he is selectable. That's our DJ that's playing all the song. So you guys can say hello to him. He is always a shy guy. So let's go with another song. Welcome back to the Ken Rampersaud Show, ladies and gentlemen. You know, today is International Women's Day, so I want to big up all you ladies who tune in here tonight. And glad to have you guys. You know, without women, you know, we are nothing in this world. You are the reason we are here on Mother Earth, okay? I also, earlier today, as we were talking about women, we were talking about women and empowering women. Here it is in Guyana now. We have Roxanne, the Honorable Roxanne George, Chief Justice. She's in Guyana, and now the decision is in her hands to rule about justice in Guyana. So we want to say big up to women, especially today is International Women's Day. So big up all of you ladies for doing such a fantastic job. Kausala Prasad, good afternoon. And it's good to have Roxanne Walker Hamilton back again. We have Maria Harris. Thank you very much for watching. Let's see. Mary Ann Lou Ramdani. Great. Good afternoon. to you, Kenneth. Thank you very much. And good afternoon, Mary Ann Lou. Always good to have you gone. Sukdev Mangal, thank you very much for watching. And Michael Nalini Naidu, thank you very much. Avita, thank you very much. Maureen Ramcharan, thank you very much for watching the Ken Rampersaud Show. Shirley Dearnorine, thank you very much. Guys, if you didn't hear I call your name, please make a comment so that I can say hello to you guys, okay? And now we go to treatment of pneumonia, as we were talking earlier. Treatment for pneumonia involves curing the infection and preventing complication. People who have community-acquired pneumonia usually can be treated at home with medication. Although most symptoms ease in a few days or weeks, the feeling of tiredness can persist for a month or more. Also, I want to say specific treatment depends on the type. And when you go to the doctor, based on all the blood work and the tests that you do, that's how they are going to treat you. Bacterial inflammation, pneumonia. It may take time to identify the type of bacteria causing your pneumonia and to choose the best antibiotic to treat it. If your symptoms don't improve, your doctor may recommend different antibiotics. But I'm sure that most of the time they really get to the point and treat you, and in a couple of days you will feel better. Coughing medicine. This medicine may be used to calm your coughing so that you can rest, especially at night. And make sure you take your medication as the doctor prescribe it, because coughing helps loosen the move fluid from your lungs, okay? When you cough, you know what happened. You cough out that phlegm and you throat. It's a good idea not to eliminate your cough completely. In addition, you should know that very few studies have looked or whether over-the-counter cough medicine lessen your cough because which is causing the pneumonia. If you want to try a cough suppressant, use the lowest dose that help you to rest. And this is a good advice they give you, to use a lower dose. A couple of years ago, I know I have severe allergies, and I really suffer with the allergies. But on one year, I was coughing so bad, I started to take a different cold medicine to suppress my cough. And it started, I'm so lucky that, I was thinking while all of this is happening, but I started to get hallucination. I was hearing things, I was seeing things. I was waking up wondering what's going on in the room, and wondering, I was like, where is Gita? And she was not there, And I was like a Chinese man in the room. So be very careful. Don't overdose yourself. If doctor recommend you take medication like within every 4 to 6 hours, do that. Do not take your medication like every 2 hours. So follow your doctor's instruction. Fever reducer, pain reliever. You may take these as needed for fever and discomfort. These include aspirin, Motrin, Tylenol, and so on. So the other thing is, I want to advise you guys, Tylenol, while it's good, sometimes it is bad for your liver. So make sure you don't overdo it with your Tylenol. Try things like Motrin, and especially if you're taking things like Motrin, make sure you take it with some milk or you have some food in your stomach, because taking Motrin, it could cause a lot of abdominal discomfort. When I say abdominal discomfort, it could cause a lot of problem for your stomach. Taking too much of pain medication can result in having stomach ulcers and so on. And hospitalization, we're going to talk about the hospitalization. You may need to be hospitalized if you are older. If you get pneumonia and you're older than 65, if you're confused about time, people, or place, your kidney function has declined, your systolic blood pressure is below meters of mercury, or your diastolic. And when we talk about systolic, we are talking about the high one, the one at the top, not the bottom one. And when we're talking about the diastolic, that's the one below. Okay, so when you have your blood pressure like 120 over 90, the top one is the systolic and the bottom one is the diastolic. Okay, let's see, your breathing is rapid. If you're breathing more than 30 beats, breathing per breaths per minute, you need to go to the doctor. Or you're breathing faster, make sure you go to the doctor. You may need breathing assistance. Your temperature is below normal or it's increased, you need to go to the doctor. Your heart rate is more, like I said, is less than 50 or above 100. And we know most of the time Our heartbeat's supposed to be ideally more than 60, like 65, 70. Some athletes, sometimes it's a little lower on the lower side, but it's always good to know your baseline of how much is your heartbeat, what's your pulse like, and what's your blood pressure. So we'll get our DJ to play another good song for you guys. In the meantime, let me say hello to some of you guys who are still watching the show. Lolita, and guys, don't drink and take your medication. Absolutely do not drink any alcohol and take your medication. It could cause a lot of problem. Girly, thank you very much for tuning in. I want to send greetings to you, Girly, and hope that your mom feel much better from last week, and hope that you're getting all the support. I know when you have someone that's sick, it's not an easy thing, but I know that you're a strong woman and that you are taking care of business. Umesh Singh, thank you very much, Umesh. You are a star, and thank you very much for watching the Ken Rampersaud Show here on Island Zone Radio and on Facebook Live. Good for you. I've always listened to your song many years ago, and the truth of the matter is, when I was younger, but probably about 20 years younger, I used to dance to all your songs then. So I'm a good dancer, but when daddy get old now, different story. But thank you very much for tuning in. I really appreciate it. Let's see, Girly Prasad, Roshani Baksh, she said very true. Mahendra Bechu, thank you very much, and good evening to you. Thanks for watching the show. Okay, let's go with a nice song. Bibi Nafisa, thank you very much. Bibi Grandi, thank you very much for watching the show. Brothers and sisters, pray for the best decision on Tuesday. Yes, I hope so too. Amir Baksh, thank you very much. And as you say that, pray for Guyana. We all know that Guyana need prayers, so go ahead and pray that God would use this one in a remarkable way, just to be fair and to be frank. And what's the sad thing about in life, and what I was thinking about is a lot of times that I can't, a lot of times I'm thinking, how can a lot of people who I know that's religious, who goes to church, and brilliant people cannot see that something was wrong. And I really do try not to get into politics and into religion, but my God, when you see something that's wrong, one needs to stand up and to say what's wrong. Okay, so let's go with a nice song, ladies and gentlemen.
Please देखा नाका ना गिना देखा चिकनी चमेली देखी चिकना कमीना देखा चांदनी चिटर होके चीट किया तो सारे तारे बोले गिली गिली अक्खा तेरी बात ज्यादा बातें बुरी बात थाली में कटोरा लेकर आलू भात मूड़ी भात मेरे भी जो किसी ने रिपीट किया तो साला मैंने तेरे मुंह पे मारा मुक्का इस पे भूत कोई चढ़ा है खैर ना जानना अब तो क्या बुरा क्या भला है फर्क पहचानना जिद पकड़ के खड़ा है कम वक्त छोड़ना जानना बदतमीज दिल माने ना बदतमीज दिल माने ना ये जो हाल है सवाल है कमाल है जाने ना बदतमीज दिल माने ना ढिमका वाला ना देखा सीन का सिंगाला खा के शेर का गुरा ना देखा पूरी दुनिया का गोल गोल चक्कर लेके मैंने दुनिया को मारा धक्का बॉलीवुड हॉलीवुड वेरी वेरी जॉली गुड राय के पहाड़ पर 3 फुटा लीली फुट मेरे पीछे किसी ने रिपीट किया तो साला मैंने तेरे मुंह पे मारा मुक्का अय्याशी के बनवे से खुद को मोड़ना जानना कंबल बेवजह ये शर्म का ओढ़ना जानना पकड़ के खड़ा है कम वक्त छोड़ना जानना बदतमीज दिल माने ना बदतमीज दिल माने ना
Welcome back to the Ken Rampersaud Show. Here, I want to say a special thank you to Priya Prasad, who lives in Guyana and who's doing such a fantastic job on the page. She is one of the admin, and she's the young lady that's saying welcome to all of you guys. So please say thank you to her and to lift her up in your prayers to continue doing such a great job. And yes, Girly Prasad, I know that it's understandable. I know that you are taking care of mom, and so you are a great woman too. So, ladies and gentlemen, I want to say happy International Women's Day to all of you. Cheers to strong, being intelligent, classy, kind, powerful, and ambitious. And I want to tell you today, if you look at the screen here, we have Chief Justice Roxanne George for doing such a fantastic job. I don't know what the results are going to be, but whatever result she comes with, one has to agree with it, and we have to respect her decision with it in Guyana. I have Mr. Albert Balde was supposed to be on. He is running a little late. What I may want to do, and I'm thinking of doing, is to do a special with him tonight when he gets here. I'm thinking even to come off a little bit early, so I'll give you guys a break and come back around 7 o'clock when he's here. But let me continue with pneumonia, the lifestyle and home remedies. Let me see. But you guys can tell me what you want me to do, and I will do just that, okay? Lifestyle and home remedy, right? These tips can help you recover more quickly and decrease your risk of complications. Get plenty of rest. Do not go back to work or school just quickly. One has to feel better, and when you feel better, then you go to school. Give your body some time to rest, because pneumonia can reoccur. Again, pneumonia can reoccur. It's better not to jump back into your routine. Take it easy until you are fully recovered, and ask your doctor. The best thing to do is to ask your doctor when is the best time for you to go back to resume your normal routine and go back to work. Stay hydrated, drink plenty of fluid, especially water, to help loosen your mucus in your lungs. And it is right, when you drink a lot of water, and water is very good. Even if you have a temperature, drink a lot of water. It's going to help you. Take your medication as prescribed. Take the entire course or any medication your doctor prescribed for you. If you stop taking your medication too soon, your lungs may continue to harbor the bacteria that can multiply and cause your pneumonia to reoccur. One thing I've heard many people say, and I've seen it in my nursing career, that a lot of times when people start taking the antibiotic, you know what they do? After they drink one or two, they start to feel well, and guess what happens? They end up feeling better, and they end up getting more sick. And they will have to start a different antibiotic or the same one, and they will have to complete all the treatment. So make sure that if your doctor order you some antibiotic or treatment, make sure that you take and you complete your antibiotic and your treatment. I'm going to wrap up in just a minute. I'm going to ask my DJ to play a song. Also, I have as a backup today to talk about emphysema. And the reason why I have that as a backup, because I didn't know if Mr. Baldeo is going to be here on time. So I have an option. I can come off, or I can continue until he gets here, and I can come back with another live. Also, we want to let you guys know to avoid things that you can do. Try not to smoke. While I was doing all this reading, I see smoke contribute to so much negatively to your health. So I would advise you guys, try not to smoke. And if you're smoking, try cut it out, because it could cause us so many problems, lungs cancer, bronchitis, and all these things. And drink plenty of fluid and get plenty of rest. Okay, so that's it for pneumonia today. I hope that I've helped at least one or two of you guys, and to make better decision and to do what's right and what's best. I'm so glad. The first time I picked up a cigarette to smoke in Guyana, I didn't know that my mother was, she was right in a room next door, and I was outside in the veranda, and I started to smoke the cigarette, and she caught me, and she said, "What are you doing?" And I said, "Nothing, Mommy." And she said, "You were smoking." I said, "No." But I didn't realize that the smell she smelled. And man, she slapped me up so bad. And guess what? Up to now, I don't smoke. I don't smoke cigarette, which is a good thing. Okay, so I encourage you guys to not smoke. All right. So let's go with some good song, and let me know if you want me to come off or you want me to continue with emphysema, and I'll come back later on. If Mr. Albert Baldeo, as you know, he's a community leader. And he's running for public office, has been in our community for a long, long time. Okay, so let's go, ladies and gentlemen. Good evening, baby. Hamid, thank you very much for watching from Canada. Andrew Ibrahim, thank you very much for watching the Ken Rampersaud Show here on Island Zone Radio and on Facebook Live. Guys, please continue to share the page, and we can ask the DJ to play the song from the top. Thank you for watching, Baby Khalil. Good night, baby hack.
ਸੋਹਣੀ ਦੇ ਨੱਕ ਦੇ ਸੋਹਣੇ ਲੱਗਦੇ ਮੈਨੂੰ ਸੋਹਣੀ ਤੇ ਨੱਕ ਦੇ ਸੋਹਣੇ ਲੱਗਦੇ ਸੋਹਣੀ ਤੇ ਨੱਕ ਦੇ ਸੋਹਣੇ ਲੱਗਦੇ ਮੈਨੂੰ ਸੋਹਣੀ ਤੇ ਨੱਕ ਦੇ ਸੋਹਣੇ ਲੱਗਦੇ ਕਹਿੰਦੀ ਮੋਹ ਪੋਤੀ ਜੈਮ ਕਹਿੰਦੀ ਏ ਉਹ ਜਾਣੇ ਜਾਣਾ ਕਹਿੰਦੀ ਮੋਹ ਪੋਤੀ ਜੈਮ ਕਹਿੰਦੀ ਏ ਓਏ 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 ਮੋਹ ਪੋਤੀ ਜੈਮ ਕਹਿੰਦੀ ਏ ਉਹ ਜਾਣੇ ਜਾਣਾ ਕਹਿੰਦੀ ਮੋਹ ਪੋਤੀ ਜੈਮ ਕਹਿੰਦੀ
Big up to all you powerful women. It's International Women's Day today. Big up to all of you and thank you for supporting the Ken Rampersaud Show. You know, Sugdeo Mangal, I'm reading your comment. You said, yes, you can stay on and keep the words of comfort coming. Someone might come in late until the guest comes. So let me start. You know, my philosophy, which I've learned a very long time, Sugdeo Mangal, I believe that life is a one-shot deal. We are all here on the face of this earth for a short time, not a long time. This is borrowed time we have. And if we realize this in life, that this is nothing to talk about, we don't know what's going to happen tomorrow. Tomorrow we can stop breathing. When we go to bed, we don't know if we are going to wake up. And so that's why I say, you know what, it's always good to be kinder, good with each other. It's a good way to start. And I love this one proverbs that I learned a long time since I was a young guy. It says, I shall pass this way but once. The good that I can do, let me do it now, because I shall not pass this way again. And, you know, like, I'm surprised that so many negative people around. But, you know, they say in life that only light can make a difference in darkness. So I hope that, you know, as we are moving on with life and there are so many things going on, that we be the source of light, that we can be the brightness in some people's life. And as I was listening and paying attention to things unfold in Guyana, I realized that there were so many things that was going right and wrong. You know, while growing up in Guyana, you know, I heard so much stories that my grandparents and my aunts and my uncle used to tell me about election. Even to my father-in-law and my mother-in-law tells me about there were so many bad things that happened in 1964, a year that I was born. And I'm doing a freelancing here. I'm just talking, you know, openly. And I've heard so many stories. And when I saw all what was going on, you know, it just reminds me, and I'm not being racial. I don't care what color people's skin